A colonoscopy is a medical procedure that lets your doctor look inside your colon and rectum for problems such as ulcers, inflammation, bleeding, polyps, and tumors. A colonoscope is the tool used to perform a colonoscopy. It is a thin, flexible tube with a light and video camera on the end. It is inserted through the anus into the rectum and is carefully guided up through the colon, all the way to the cecum. The colonoscope can usually be used to enter the very end of the small bowel, known as the terminal ileum. The front tip of the colonoscope contains a video camera, which sends real-time images to a computer screen so that your doctor can examine the colon. The front tip also has a light, a channel for water irrigation, a channel for air and water, as well as an instrument channel. The irrigation channel is used to flush water or air into the colon to remove debris or stool and see more clearly what the inside of the colon looks like and to check for polyps. Special tools such as tiny forceps or wired loops or snares can be passed through the colonoscope to remove polyps and take samples, called biopsy, of suspicious tissue in order to look for signs of cancer. A colonoscope usually takes 30 to 60 minutes and is performed in a hospital or clinic by a trained doctor, known as a gastroenterologist. You will be offered a sedative to help you relax during your colonoscope, and you will be placed on your side for the procedure. Your doctor will carefully insert the colonoscope into your rectum and advance it to the end of your colon, to your cecum. The colonoscope bends, so your doctor can move it around the curves of your colon. Your doctor might gently press on your abdomen during the procedure or ask you to change positions occasionally to help move the scope through the colon. During the entire procedure, a magnified high-definition video from the colonoscope plays on a monitor in real time, so your doctor can thoroughly examine the lining of your colon. Video may be recorded and photos are taken as well. A small amount of air may be blown into your colon to help expand the passageway so that your doctor can see better. This can make you feel pressure or mild cramping, but can be eased by taking slow, deep breaths. The colonoscope is then slowly pulled out while your doctor carefully examines the inside of your bowel. If your doctor finds polyps or suspicious areas during the colonoscopy, the polyps will be removed and small tissue samples will be taken to be checked for signs of cancer. Polyps are usually not cancerous, but they can change into cancer, and that is why they need to be removed. Polyps are removed with biopsy tools or wire loops that get passed through the scope into the colon. The most common removal technique is called snare polypectomy, where the polyp is surrounded by a wire loop and then an electric current in the wire burns off the polyp. The polyp is then pulled through the instrument channel and collected for biopsy. Other methods are available depending on the size and shape of the polyp. Polyps contain no nerves, so you won't feel pain during their removal. After your colonoscopy, you will be taken to rest in a recovery room until the effects of your sedation wear off. You may feel some gas or cramping, but this will quickly pass. Because of the sedation used during the procedure, you will need a family member or a close friend to drive you home. You should take the rest of the day off and not make any major plans for 24 hours. Before you go home, your doctor will share the results of the colonoscopy with you. Now we uncover the 8 most common warning signs of colon cancer. According to health organizations, colorectal cancer is one of the most common cancers worldwide, and while it often develops silently, there are warning signs your body may give you. The most common signs include a change in bowel habits, including constipation, diarrhea, and incontinence. These are usually symptoms of other less serious problems, but they can also be symptoms of colon cancer. Blood in your stool can also be associated with colon cancer. Your health problems can cause bleeding in the digestive tract, but if you start to experience bloody stool, see your doctor to rule out a serious condition. Another sign of colon cancer is unexplained anemia, a shortage of the cells that carry oxygen throughout the body. If you are anemic, you may find that you are tired, sluggish, and short of breath, and that rest doesn't help. Other possible signs of colon cancer include abdominal or pelvic pain or bloating, unexplained weight loss, and vomiting. Because colon cancer can grow slowly, you may not experience any symptoms of the disease. These symptoms may also occur with other non-cancerous conditions, emphasizing the importance of proper screening, such as a colonoscopy, to examine your large bowel. Other tests, like stool-based tests, blood tests, are useful but lack the preventive benefits of polyp removal. Your risk of colorectal cancer rises as you age, so you should start being screened or colonoscopy at age 45, because they are vital for colon cancer detection and prevention. They allow for early diagnosis, which significantly increases treatment success. Removing polyps during the procedure can prevent cancer from developing, providing both medical benefits and peace of mind. Other risk factors include living a sedentary lifestyle, consuming high quantities of alcohol, eating a high-fat, low-fiber diet, smoking, obesity, and a history of inflammatory bowel disease or diabetes. How can you reduce your risk? Beyond regular screenings, there are simple steps you can take to reduce your risk. Eat a diet rich in fruits, vegetables, and whole grains. Limit red and processed meats. Stay physically active. Regular exercise can help you maintain a healthy weight and reduce your cancer risk. Avoid smoking. Tobacco use is linked to many cancers, including bowel cancer. Limit alcohol consumption. Stick to recommended guidelines for alcohol consumption. Remember, a healthy lifestyle supports not just your colon, but your entire body. What are the treatment options? If bowel cancer is diagnosed, treatment will depend on the stage of the disease. Here are an overview of the main options. Surgery. This is often the first line of treatment. It involves removing the affected portion of the bowel, and in some cases, nearby lymph nodes. Chemotherapy. This uses drugs to kill cancer cells and is often used alongside surgery. Radiation therapy. High-energy rays are used to target and destroy cancer cells, particularly in rectal cancer. Targeted therapies. These are newer treatments that focus on specific molecules involved in cancer growth. Your healthcare team will create a personalized treatment plan to give you the best possible outcome. The reality, though, is that anyone can get bowel or colorectal cancer, regardless of their risk factors or family history. But with prompt treatment, the outlook is hopeful for people with colorectal cancer. Colorectal cancer can be deadly, but data shows that early screenings are saving lives by detecting colon cancer earlier than ever before. Know the signs, stay vigilant, and get screened. Your health is in your hands. I hope this video has helped you understand bowel cancer better. Please give it a thumbs up, share it with your loved ones, and subscribe for more health tips. Remember, your health is your greatest asset. Take care of it. Thank you for watching, and I'll see you in the next video.